Have you been told by a family member or a friend that you have bad breath? If so, it's time to visit your dentist. 90% of all bad breath, also known as halitosis, originates in your mouth. Even though certain diseases and a condition commonly called dry mouth can affect the state of your breath, the majority of bad breath originates from bacteria found on the back of the tongue. They are also caused by the bacteria in plaque that build up on the teeth at the gum line. These bacteria produce sulfur compounds that give off the foul odor associated with bad breath. Good oral hygiene is the key to fighting bad breath. First, control the bacteria that produce the sulfur compounds by removing them from your tongue with a toothbrush or tongue cleaner. Make sure to brush and floss after every meal to help reduce the odor-causing bacteria that build up on the teeth and gums. Second, neutralize the sulfur compounds that are produced by bacteria by using an antiseptic or antibacterial rinse that kills bacteria, rather than a cosmetic rinse that just masks the odor. Make sure to keep your scheduled dental cleaning appointments and speak to your dentist if you feel that you have bad breath. If your bad breath persists even though your mouth is found to be healthy, the dentist may refer you to your physician to determine the cause of the odor and an appropriate treatment plan.